ka na Patty? Hi. Good day, everyone. Today, we, the Group 3, will discuss the T-tube cholangiography. Next. What is biliary system? The biliary system, also called the biliary tract or biliary tree, is a system of ducts or organs, including the liver, gallbladder, and pancreas, and associated siya sa structures that function to produce, store, secrete, and transport bile. Functions of the biliary system includes draining the waste products from the liver, secreting bile in the controlled release manner, and transporting bile and pancreatic juices to help break down food in the small intestine. Next. So, what is T-tube cholangiography? Cholangiography is used to clearly view the position of bile ducts during a gallbladder removal or cholecystectomy, or to check and see if there are gallstones in the bile ducts. A cholangiogram is an imaging technique that uses a contrast dye that is injected into the bile ducts to view the ducts on X-ray. So, T-tube cholangiography is a special X-ray procedure na may contrast media para ma-visualize yung bile ducts after the removal of the gallbladder. This examination will visualize any stones na natitira sa may bile ducts. So, gumagamit ng T-tube para i-insert sa bile ducts during ng cholecystectomy or yung surgical removal ng gallbladder. Tapos, iniiwan lang doon. Tapos kapag nalagyan na ng contrast media, tapos nakuhaan na ng X-ray, kapag wala ng nakitang stones, yung tube is pulled out na. So kapag may stones pa, pwede siyang i-remove gamit yung ECRP or yung endoscopic retrograde cholangiopancreatography, or pwede rin by stone dissolving solvent administered through tube.
So, the indications of the T-tube cholangiography. So, yung mga patient na may possibility na meron pang natitirang small gallstones sa post-surgery nila, like the cholecystectomy, which is the removal of the gallstones. And next is the bile duct strictures. Bile duct strictures, ito nag-occur siya. So, kapag yung bile duct is nagiging smaller or nagnanarrow siya, nagnanarrow yung tube. And next is the obstructive jaundice. Obstructive jaundice, ito naman nade-develop siya due to narrowed bile duct, and nakakapag-prevent siya ng normal drainage of bile from bloodstream into the intestine. Kasi nga, ayun, merong barado doon sa bile duct. And next is the abnormal growths and the abnormal fistulae. Abnormal fistulae, ito yung abnormal connection between two body parts such as an organ or blood vessel and another structure. Next, the contraindications of the T-tube cholangiography: allergy to iodine, shellfish allergy, pregnancy, patient's refusal, previous reaction to contrast, and barium study within last 3 days. Next.
How the T-tube cholangiography procedure works. After the gallbladder removal surgery, a T-tube is left in place to facilitate the drainage. Cholangiography typically occurs 5 to 10 days later. You will lie on your back on X-ray table, and an antiseptic solution is used to cleanse the T-tube before mag-insert ng contrast media. The contrast media is injected to the T-tube. You may feel a bloating sensation in the upper right abdomen as it is injected, and X-ray and fluoroscopy are used to visualize the biliary tract, and you are instructed to assume the various position as X-ray films are obtained. And the procedure is will take about 15 minutes.
So, sa preparation, NPO, 4 hours prior. So, what is NPO? So, yung NPO is muscle by mouth. So, it is used to describe a situation when the patient is expected not to eat nor drink or to ay or ng pag-take ng food or water. So, especially before and after the surgical procedure, is bawal silang kumain. Then, syempre, uh, kailangan ng signed consent. Then, food is blocked the day before to cool it back, preventing the air bubbles. Then, the standard pre-operative preparation is, however, required before the cholecystectomy and food and drink restriction. So, ayun nga yung sa NPO.
So for the equipment needed, we have the X-ray tube, also fluoroscopy tube, T-tube inserted into the bile duct, 20 cc syringe, 18 gauze needle, and then 2 Providone iodine swabs, also 21 gauze butterfly needle and tubing, sterile 4x4 gauze, hemostat also, and then 20 cc 30 to 40% iodine water soluble intravascular contrast. So for the projection, the patient must be in a supine position to begin. Yun po yung nakahiga sa ating x-ray table. And then after the contrast is inserted, the patient moves through a variety of different positions to help better visualize the doc. So for that position, kapag po need natin yung patient na i-move para mas makita natin kung nasan yung visualize natin yung sa bile duct. And then after about 15 minutes has passed, since the contrast injection, a final erect image is taken to record the emptying of contrast-laden bile into the duodenum. So extras, if trouble arises while trying to fill the ducts, placing the patient in the Trendelenburg position will normally help. So for the position of Trendelenburg, mas mataas po yung ating feet kaysa sa ating head. For that position, mas makaka-help siya normally. Also, it is important to check for the bile leakage at the wound site. Yes, mas important din po yun kasi what if kung may leakage pala dun sa ating wound site. Also, be aware of any itching or rash after the procedure. So for the contrast, we need the iodine base. Siyempre, mas important din yun. Water soluble and then 20 cc syringe is inserted.
So, sa recovery time naman, if the food is left in place, a sterile, closed drainage system is attached to it. So, syempre, kailangan din natin ng safety and syempre malinis na uh, pinaggawaan or pinag-procedure. If the tube is removed, a nurse applies a sterile dressing and records everything. And then the dressing is changed as necessary. Then you may gradually resume your normal activities. Just like yung pag-inom ng tubig or pagkain. Kasi syempre, ano na to recovery time eh. Hindi naman siya yung before and after ng procedure. So, ayun. Tissue inserted to the common bile duct. So, dito, pinapakita dito sa picture na to, ito yung, tissue. And then, makikita dito yung, hindi, yan pala yung position niya kapag i-insert na yung tissue sa patient. And then, ito yung mga example tissues na nasa loob na yung tissue. Ayan, ayan siya. Ganyan yung itsura.
So for the radiographer's role,
So ito yung mga role nating mga rad techs or radiographer. Ang this examination uses X-ray, of course, and contrast media, ay contrast agent to produce the image of the yung goal natin, which is the biliary drainage system. So, the contrast is injected to the existing T-tube or the catheter, and by injected that, makakaproduce tayo ng radiographic image. Tayo din yung radiographer nag-assist sa injection ng contrast. And syempre, tayo yung mag-examine sa patient, and we, the radiographer, also has responsible for the questions of the patient. Siyempre, for the first-timer patient is may mga doubt pa yan sila. So, yung tayo radiographer is isasagutin natin yung concerns nila in a good manner para magiging kampante sila during the examination. And we also, the radiographer, obtaining the radiographic image for the study. Next is the pros and cons. So these are the advantage and the disadvantage of the T-tube cholangiogram. So according to Gorosami, published at 2013, yung disadvantage daw ng ay yung pros daw ng T-tube T-tube cholangiogram is nag-i-include daw dito yung drainage of bile in the setting of papillary edema and access for postoperative stone retrieval, or also called as the cholangiography. And then sabi niya din naman, yung cons daw ng T-tube cholangiography is that nag-i-include daw dito yung tube migration, obstruction, and bile leak following removal. Although, the closure over the T-tube is typically referred approach, but a recent analysis suggested that the duct can be closed primarily without an increase of uh, morbidity or mortality. So that's all for the group 3. Thank you po.